And in our next panel, we're going to hear from sustainability strategists and corporates on how to realize the business case for sustainability and monetize sustainability initiatives using CSB's Return on Sustainability Investment, or ROSI framework. To lead this conversation, I'm delighted to welcome John Platko, who's the managing partner of ALO Advisors. He brings 30 years of experience in business, sustainability, health and safety leadership, and has been an essential partner to CSB in the development and the deployment of ROSI. So welcome, John, and I'll leave it to you to introduce your panel.
Great. Thank you very much. I'm assuming the microphone's on? Yes. Well, I think we heard a couple of things in our last panel, and we're here to make sustainability thrilling and exciting and sexy from what we heard before, right? So we've heard a lot about some of the concepts and some of the ideas behind monetizing ESG or monetizing sustainability. And I think the center has done great work over the last 6 or 7 years in actually developing a methodology to do this. Many of you have probably seen some of the graphics that they have that illustrate ROSI and how it works. And we're fortunate enough today to have 3 actual practitioners here join us. And we're going to go through some of the reasons why they implemented ROSI, some of the ways and the methods by which they did that, and some of the results that they realized, to give you an opportunity to get a practical look at how these benefits are actually articulated. You know, we hear about environmental benefits, we hear about social benefits. We're all trying to drive towards those benefits. And we even talked a little bit about trade-offs this morning. It's not all about trade-offs. These things can also be economically beneficial. They can also benefit the business. And it can happen simultaneously. And I think we've got 3 examples of that here today. So what I want to do is introduce each of our panelists and give them a little bit of an opportunity to talk a little bit more about their efforts. You're going to find that they're from very distinct and different industries. We have healthcare represented, we have fast-moving consumer goods, and we have food and beverage in the agricultural space. I think one thing you're going to see is how effective ROSI can be across all of these different industries. And I think it'll be a very interesting discussion. Let me move on a little bit with introductions. First, we have Gary Cohen. Gary's the president and co-founder of Healthcare Without Harm. He's been involved in this for more than 35 years and has been building coalitions around the world to address sustainability issues in the healthcare space. Next, we have Mike Tiers. Mike's the director of Global Energy Solutions at Kimberly-Clark. He's been with the organization for more than 25 years and really has been a leader in driving decarbonization and energy efficiency and water reductions throughout the organization. And then we have Virginia Covo. She's with AB InBev and is head of sustainability in North America. Virginia's been leading the group's climate agenda over the last 4 years and oversees climate strategy, including AB InBev's 2025 climate action goal. So we have 3 great participants, and if you'll recall from Tansi's presentation, each one of these had a ROSI project up there as an example. So, Mike, let me start with you. Why did you embark on the ROSI journey, and how did that get started inside your organization, and who were the people that were involved?
Sure. Thanks, John, and thanks for the nice introduction. So, for those of you out there that don't know Kimberly-Clark, right? So we make great products like Huggies diapers, Huggies pull-ups. We make Kleenex, right? Kleenex brand. We make Cottonelle brand bathroom tissue, and we make I said Kleenex tissue as well. So So the reason I bring those up to start off with is I think what we're faced with are hard to decarbonize inputs, right? So, and what I mean by that, for tissue, 60% of our scope 1 and scope 2 are based on our natural gas consumption. And I think everybody realizes that there's challenges there, both in the fact that technology is still evolving and the cost to change is quite high. Our cost to substitute is quite high. I think the reason I bring up our personal care or Huggies is because raw materials, right, heavily relying on plastics, right? Our tissue's heavily reliant on forest fiber. So, and those alternatives, they're just really not at scale in the industry right now. And so the question is how do we monetize some of these sustainability benefits that we'll talk about as we progress into this panel discussion, and help drive in the short terms decarbonization solutions.
Excellent. Thanks, Mike. Virginia, how about you in AB InBev? Why did you go into Rosie, and who were the folks involved in your organization as you moved into this journey?
Hi, everyone. And is this working? Okay. And thank you, John. Very excited to be here. For those of you who are not familiar with AB InBev, we are the world's largest brewer. We brew beers like Budweiser, Stella Artois, Michelob Ultra. I currently head up the practice in the United States. We're known here as Anheuser-Busch. So Budweiser, the king of beers. And as you guys know, yes, yes. As you guys know, sustainability is embedded in everything we do. Why? Because we depend on natural environments and thriving communities. Our product is 100% dependent on crops like barley, rice, and hops. We work directly with over 700 farmers across the United States, teaching them and working with our agronomers in how do we implement more sustainable practices. So clearly, when we set our ambition to achieve net zero back in 2021, and we presented this to the board, obviously one of the main challenges was where's the return? What is it that you're bringing to the table? And yes, although the environmental benefit, like John was saying, is there, the social benefit is there, it's very hard to measure the financial benefit, especially outside your four walls. So we had a very good business case when it comes to scopes 1 and 2. We know the technology is going to take time. We've been piloting hydrogen fuel stations. We've been piloting renewable solar thermal energy. All of this you can find on our net zero roadmap. But then measuring the return on the investment in your value chains is extremely hard. And that is what took us to Rosie, and basically looking at our agricultural supply chain and understanding how the implementation of these methodologies like our nutrient management system, which we call the 4 Rs, actually brought benefit, not only on the bottom line, but also on top line growth. And how can we sell this inside the business so that we can help the company grow? Because at the end of the day, if sustainability does not make a business case, I think we're going to be headed to some very troubling times in the future, not as AB InBev, but I think the world, right?
Excellent, excellent. Gary, I know you're just beginning to work with the Rosie methodology, but applying it in a very different space, in the healthcare space. Maybe you could tell us a little bit about where you're at so far.
Yeah, so I was, in the mid-1990s, I was helping communities that were impacted by toxic chemicals. They might have been next to dumps or incinerators or down the street from a petrochemical plant. And there was new science that was coming out that said that low doses of chemicals in the first 1,000 days of a child's life in the womb and in their early years could have a profound impact on their health. And the two poster child chemicals for that low dose exposure were dioxin and mercury. At the very same time, the Environmental Protection Agency was saying that medical waste incinerators were the largest source of dioxin emissions in the country. There were 4,500 medical waste incinerators. Many hospitals, almost all of them had them. Burning plastics, burning broken mercury thermometers. And that they said also that healthcare was one of the largest sources of mercury contamination, which led to mercury going out into the environment and into the water, into the fish. And pregnant women were being told, don't eat fish at the top of the food chain, tuna, swordfish, etc. And so we said to ourselves, what possible way can we have a sustainable society if the very sector of our economy that has healing as its mission is itself poisoning people in service of healthcare delivery? And so that was the reasoning to even start this nonprofit organization. When we started, there were 4,500 medical waste incinerators in the country. A decade later, there were less than 100. When we started, mercury was the gold standard for measuring thermometers, blood pressure devices, and 13 years later, there was a global treaty phasing them out. And part of the impetus was actually not the business case, it was the moral case, it was the mission case, the cognitive dissonance between treating people with chronic disease, dioxin contributing to cancer, birth defects, learning disabilities, mercury impacting the developing brains of children, leading to cognitive deficiencies. Healthcare can't be in a position like other businesses. Well, it's just the cost of doing business. So what we learned, though, is that all of those interventions to deal with medical waste save money. If you reduce your amount of infectious waste, if you reuse certain materials, if you reprocess, we talked about reprocessing, taking certain devices, instead of throwing them away, re-sterilizing them, and then using them again and buying them back at 50% off. So that market grew from almost nothing to now almost $1 billion a year. The innovation to move away from mercury measuring devices was both a cost avoidance issue because you didn't have to train people to do mercury spills. You didn't have to have hazmat suits. You didn't have to worry about liability for dumping mercury down the drain. You didn't have to buy all these extra thermometers because there were hundreds of millions of mercury thermometers being broken. So it turned out to be a really strong business case on top of the healthcare case. And then we went from there to say, well, can you build cancer centers without carcinogens? Can you build children's hospitals without chemicals linked to birth defects? Can you serve food that doesn't have the overuse of antibiotics that are making your antibiotics in your systems ineffective? And then we went on and on and on to then ultimately focus on climate, which we'll get to.
Yes. Thank you, Gary. Let's talk a little bit about the how-to aspects of this. So, Virginia, as you got into the ROSI evaluation in your supply chain, how did you go about identifying the benefits? How did you go about identifying the cost? As Tansi said, it's very difficult to find the data on these things sometimes. There's going to be gaps. There's going to be assumptions you have to make. What was your experience working through that with the ROSI methodology?
Got complicated quite fast, was the first thing that we realized. You have to engage with a lot of people within your organization, all the way from the farmer and the agronomer that's implementing the practice, both to understand the cost and also understand the benefits. So there are some benefits that are kind of like more obvious, like carbon savings, although with the new GHG methodology that changes, but let's leave that aside. Carbon savings, how we're measuring our emissions, water savings, urea savings. These are things that we can find in the field, but you need to engage with the farmer and the agronomer and capture data from them. Then you need to go to your supply team and understand we are very fortunate that we're actually highly verticalized. So we have our malt houses, but then we go to our breweries. So you can see where I'm going with this. Our entire value chain all the way at the end to, okay, now we need our marketing team and our sales team. So we went all the way starting with supply, and then we realized, oh, we actually need our marketing team, our commercial teams to tell us how, in our example with Michelob Ultra Pure Gold, how did they actually do? With that wonderful commercial that they launched about 3 years ago at the Super Bowl, where they were marketing organic farming and how they were going to finance farmers to convert into organic farming, and they would guarantee the purchase of the products 5 years from when they were launching the program. So all the way to getting to there, that was months of work. I think it was last year, I think it was the entire year, if I'm not mistaken, that we took kind of like gathering data, iterating, looking at the assumptions, making some sense of what made sense, what did not make sense, And then we were able to actually get to something really nice that you can actually see on the paper that I think it's close to be published. But yeah.
How were your finance people involved?
Finance, that was they were more of consultants and more of like, we would report to them what the results were. So they were more of like my stakeholder that's gonna help me sell in and show the results to the company. Because we're looking much more at what is the sales data, what is the cost of input, which I have from my procurement team, from my agronomers, but finance can help me kind of like give the stamp of approval when it comes to looking at the business case and asking the difficult questions. Like making sure that it's foolproofed so that when you go and sell it to your senior stakeholders, they already have a say. Does it make sense? Does it not make sense? So they really did push back so that we had to go back to Tansi and tell them like, hey, no, we need to kind of redo X, Y, and Z.
Understood. Gary, a question similar to you. I mean, you're involved in going through the methodology right now, and I think as Tansi said, you've got some choices. I can have anesthesia that's, decarbonized, or I can have the carbonized version. And you don't even think of those things, right? When you're in the medical space, very different than in the consumer product space. How do you anticipate the benefits and the cost being monetized as the team works through this with you on healthcare?
So the good news is most of the interventions that are about detoxing the supply chain, as it were, and decarbonizing the supply chain in the buildings, they have financial benefit. So it turns out it was an anesthesiologist in one hospital in Oregon said, this isn't more effective than the other anesthesia that we use, and it costs more than the rest, and it's 2,000 times more potent than carbon dioxide. Why are we using that? And that then spread to other anesthesiologists in that system, Providence Healthcare. They've got 52 hospitals. They said, let's do it for the whole system. And then we've built this network in this country and around the world of hospitals that are all on this journey together. So it creates the opportunity to share best practices that may be coming up from anywhere in this network around food, around anesthetic gases, around energy, around pharmaceuticals, around so many different products that are sold, including some of yours, in healthcare, and then leveraging the market aggregation of demand to then drive the market toward innovation and drive the price down. So now, just last week, NHS, the National Health Service in Britain and Scotland, banned this anesthetic gas. It'll happen in this country within the next year. And what we've seen is that we don't have to be the experts in all of these matters, that the nurses in some hospitals and the doctors in other hospitals and the food service people in other hospitals are making the business case. And our job is to then elevate it, make the case study, tell Tansi and her team about it, and build the aggregated demand and standard setting that can actually completely drive the marketplace. I'll give you another example. There's furniture that's sold in healthcare that it off-gases these toxic flame retardants. It's made of PVC plastics. It's got formaldehyde. And we said, that's nuts. Why are we off-gassing toxic materials in a hospital setting? So we developed a standard, said we want to encourage the suppliers to say we want furniture without those toxic materials. Kaiser, Cleveland Clinic, Partners Healthcare in Boston all said, well, we'll do it. So that within 6 months, it was a $50 million market demand. And now over the last several years, that demand is now up to $700 million. And the manufacturers have responded. And they're making products without these toxic chemicals in them. So I think what we've learned is that there's a really big power of demand. And when the demand comes, then sometimes the policy comes. The policy may be hard to do first, but you can create the demand and the market's already moving. And then the politicians feel like it's safe to then pass a policy.
Fantastic. Mike, could you talk a little bit about your experience and maybe add in a little bit about how you dealt with the many uncertainties that are involved in this?
Okay, that sounds good. So before I jump into that, I just wanted to expand on some of the comments that Virginia made. So I think a lot of our internal steps and our processes were the same that you described. I think one of the key ways to get started is really to ask for help, right? So we used ALO, we used our host today, NYU Stern, to help us navigate, at least initially, how to lay out ROSI. And really where we needed the most help were things that we didn't know, right? You don't know what you don't know, so somebody needs to tell you sometimes. And that's what the consulting firms helped us do. I think the other thing that we did that was extremely helpful, and I don't know if it's a coincidence, but we did publish our TCFD report just prior to launching ROSI. And what that does at a macro level helps us understand what our risk and opportunities are, as well as helps us understand how we monetize that. So ROSI is nice because it helps you deep dive, but the TCFD gives you that more macro look. And I guess one other thing you asked about the finance team, John, I think for us, we want them to own it, right? They own the methodology for justifying projects. We believe that in order for this to be successful, we don't want a brand new process, because every time you build in a brand new process, probability of failure goes up. So we need to make sure that we embed it. So we're putting it on our finance team to embed it in the current process.
Fantastic, fantastic. Let's switch gears a little bit towards the results. And Gary, I'll ask you this question first. So as you start to move through the cost and benefit analysis, and you're starting to see, some of the early signs, what are you expecting in terms of results, and what do you think those outputs will be that will turn into outcomes and impacts, as Tansi mentioned earlier? What are you expecting?
So I think we're now working with more than 1,000 hospitals in the country, all the Veterans Administration hospitals, all the military hospitals, lots of the nonprofit hospitals, some for-profit hospitals, all on this climate journey. And they're making commitments around net zero. And it turns out that 70% plus of their carbon footprint is in the supply chain in their investments. And so what we expect to see is dramatic purchases of renewable energy, of energy efficient equipment, of changes in their food purchasing for more plant-based diets and more sustainable meat that they buy and fish. There'll be reduction in single-use plastics, which is a huge climate and toxics issue. There'll be changes in anesthetic gases. There'll be changes in telemedicine as more people, we learned through the pandemic. It's for many reasons, it makes sense to have a consultation with your doctor or nurse on a Zoom call or over the phone than having to schlep all the way into the hospital. And so there'll be changes in practice. There'll be changes in supply chain. And one of the things that's so unique, and it hasn't come out here yet, is that healthcare can also show health outcomes. When we talk about the benefits of sustainability, we need to also be talking about how it impacts our health. So healthcare is, as we said, is 9% of emissions in the United States. That means healthcare is killing 100,000 people through their reliance on fossil fuels. That's the same amount of people dying from medical errors in hospitals. So as we move away from fossil fuels, we're actually cleaning up the air. We're reducing asthma. We're reducing heart disease. We're reducing stroke. As we buy food that's more sustainable and local, we link it with food as medicine strategies in our healthcare system, and we reduce diabetes and obesity and cancer and heart disease. As we invest in healthier housing, we can make them more efficient, but also can reduce the kind of triggers in housing that brings kids again and again to the emergency room with asthma. So there's a health benefit to sustainability that we need to be incorporating. That's part of the narrative that we need to be saying. Even if fossil fuels were not the driver for the climate crisis, it's the driver for incredible amount of death and destruction and people's health damage around the world. A new study from Harvard a couple of years ago said that 8 million people globally are dying from the emissions from fossil fuels. That's more than twice than AIDS, malaria, and TB combined. So we need to begin to build this health argument, because that people in Arkansas and Texas care about their kids as they do in New York and Massachusetts.
So Gary, connect the dots for us in terms of these changes, these impacts, these outcomes that you want, and how the ROSI methodology can help enable that or can help drive towards that.
Well, I think the ROSI methodology is showing that there's a problem with an environmental health issue in healthcare, in the product or the technology or the delivery system. You can make a change that actually saves money in the short term or in the longer term. There's different time horizons. And there's a health co-benefit in those messages. And I think we hope to actually help evolve the ROSI methodology to start to include health and social impact in that framework.
Fantastic, fantastic. So Virginia, this project has been done for a while now, and I'm assuming that you're starting to see some impacts, and you're anticipating future things that you might do with ROSI to continue to drive business results and sustainability results simultaneously. Can you tell us a little bit about that inside of AB InBev?
Yeah, so we are a fast-paced company. So when something is adopted, it's adopted quite fast, which is a good problem to have. You can say it's a good problem to have. I have a lot of work now because everybody wants to measure their benefit. Because of course, everybody wants to show, hey, this is the value that I'm bringing to the company. And not only because we've always have it very figured out when it comes to supply chain, because we have a very rigorous process. We're very challenged internally when it comes, because we manage our costs very tightly, and we're known for that around the world. So when it comes to cost, CapEx investment, supply, like we kind of know, and this was a very good addition to understand the financial benefit of our supply chain. Now, when it comes to the financial benefit of avoided sales loss, when it comes to when we measured the impact, of course, there are some assumptions, but when you measure the impact and the positive impact and return a brand can have, now all of a sudden I have all of the brands excited. We have everybody from the categories extremely excited. So it's cascading quite fast. So I have to actually manage my stakeholders internally and be like, hey, I need a bigger team to actually do that. But we'll figure it out. I mean, it's all good. I think what we learned is that the ROSI methodology can be implemented across the business. We just have to find the perfect way of doing it without becoming catastrophic, or in terms of not catastrophic, but chaotic, is what I mean. And I think, yeah.
Excellent, excellent. So, Mike, from Kimberly-Clark's perspective, what sort of results have we seen? We saw the slide earlier, and it's already opened up a kind of whole new opportunity,
yes.
But that and beyond.
Yeah, so I think everybody here, most people saw the slide at the beginning of today, but for those that didn't, so we're looking to initiate a green hydrogen project in our UK operation, which will deliver somewhere between 30 and 50% reduction in our consumption of natural gas, right? So we'll replace that with green hydrogen. You say that's a pretty big percentage, but it depends on the incentive package that we get, and hopefully in the next couple of months we're going to find out what that will be, but it'll be somewhere between 30 and 60%. And that's about 25,000 to 50,000 metric tons of CO2 reduction, so pretty significant. And more importantly, it's on thermal energy, right? Thermal energy is extremely difficult and expensive to decarbonize, so we're super excited about this. And I think, things that we learn through going through the ROSI process, we're going to try to, translate this into other parts of the world, right? In the southeast United States is a hot spot right now for green hydrogen, other places in Europe, and potentially other parts of the world.
Excellent, excellent. So I have one more question for the panel before we open it up to the audience. So I know myself and the center, we're always interested in trying to figure out ways to improve and to elevate ROSI. So if the Rosie Genie was here in front of us, and the Rosie Genie would grant you one wish for Rosie, what would that be? Virginia, what would you wish for?
God, I think I would love to see how my consumers are going to actually behave, because I think, I don't know if any of you here in the audience are in consumer products, and I think Mike can relate to this. What they say and what they do is different. And also the beer pricing is, consumers are very sensitive to beer prices. So one of the assumptions that we made in the model is that obviously consumers are willing to pay more for sustainable products. And in this case, Michelob Ultra Pure Gold is a higher price range product, but it was launched as a little bit of a more premium product. We call it Core Plus. But it's very different to do that than to suddenly say tomorrow, my Budweiser is going to cost more because it has renewable electricity, which it does. And there's a logo on the back that says renewable, brewed with 100% renewable electricity, and a beautiful commercial from a 2018 Super Bowl. You should watch it. It's on YouTube. But it's one thing is to have a product that is developed for that consumer, target consumer a little bit more. And another one is to just increase the price of a regular product, because now all of a sudden we're saying that it's sustainable. So I wish my genie would be able to go into their minds and tell me if I could actually do that.
Excellent, excellent. Gary, you're early stage in the Rosie process, but if the Rosie Genie were here and you wanted to ask for one wish, what would you ask for?
I would ask to work with NYU Stern to make the business case for changing the entire business model of healthcare to focus on keeping people healthy as opposed to treating them when they're sick. Because healthcare is 20% of the US economy, 10% globally. It's the one sector that is focused on health as core to its mission, the Hippocratic Oath. So what does the Hippocratic Oath mean in a world where 9 out of 10 people on the planet are breathing air that's not healthy for them? What does the Hippocratic Oath mean in a world where 1 billion children, this is what UNICEF says, 1 billion children's lives are going to be threatened by climate change? The very nature, the very mission of healthcare has to change in this next century, to focus on keeping people healthy, to hold the trauma, the collective trauma that we will all face as a result of climate change. NYU Langone in Sandy was evacuated. They lost $1 billion. And in the very moment when New Yorkers needed it to be functional, to be able to go because people were injured, it had to be evacuated. So these sustainability issues, these ways in which healthcare is at the epicenter of both sustainability and climate response and equity issues, we need to redefine the very nature of what healthcare is about in this next century. And that's the business case we need to make.
All right, I think the genie may be out after that one. That's excellent. Thank you very much.
I don't want to follow that. I don't want to follow that.
Yeah, I'm sorry you have to, so.
All right. Plus, I thought genies give 3 wishes, John.
Well,
just one? No. I'll just take one. So I guess as I think here, I think it's more about information, right, and data. So we talked earlier about there's a lot of missing data out there that would help us monetize. And I think if I think about one thing that would help me, my organization really drive the monetization and the buy-in to our leadership and to our different business units would be to have sort of a database of benchmarking by industry, right? So there's nothing more powerful than to say, hey, look at our peer group, look at the benefits, look at the value that they're driving from making claims, look at the drive that they're making from investing in hydrogen, and there is some information out there, but there's a lot of doubt for a lot of reasons we talked about earlier today. The panelists talked about earlier today. So that would be my one wish.
Excellent. Thank you very much. We have the opportunity now to open this up for some questions. These are actual practitioners who have deployed Rosie, who are in the midst of trying to monetize the benefits, the business benefits of creating these positive social and environmental impacts. So now is your chance to ask the questions about how and why and all the things that we started to probe of this panel.
Thank you so much for an incredible conversation. Gary, I cannot applaud you any stronger. I'm a physician and I'm a corporate wellness consultant. And if we don't take care of this immediately, we're going to bankrupt the globe, basically. I'm a practicing physician where food is medicine, movement is medicine, the science and the data are not confused on this. Plant-based diet, 80% of our health is in our hands. So people, the messaging really needs to change on this. If you're waiting for hospitals and doctors to keep you healthy, you are sorely misguided. So 80% of our chronic diseases, which is bankrupting our globe, things like cancer, diabetes, heart disease, totally preventable and reversible with lifestyle choices. This is about making good choices with the science that we have. Thank you so much for your comments.
You know, one of the things that there's this huge movement now to decarbonize healthcare, and the thing that we are saying is that we don't want you to be decarbonized versions of yourself, these sort of gleaming towers of chronic disease management. The greenest hospital is the one we actually don't need to build.
Fantastic.
Hi, thank you so much. A question for you with the ROSI methodology and where you saw it really paying off. I heard you talk about supply chain. What kind of initiatives are you seeing the real return on the ROSI methodology as you're integrating it into your business practices and analysis?
I'll take this one just from the example on where we analyzed the methodology. So we actually implemented it on what we call 4R, so nutrient management systems in agriculture. So some of the things that you know for a fact, like I was saying, carbon emission reduction, we can measure, we know, but at the same time, when you do proper management with your nutrients, you actually get lower protein content. What does that mean? That means a much more efficient malt house because it actually has higher malt extract and actually brings less headaches to the malt house. The same happens at the brew house. So it kind of trickles down and you think, okay, malt house, better barley, great. But having higher protein content on your barley, not only do you have higher yield, therefore if you have a higher yield, better because you have more extract, therefore you can get more beer from less barley. But also, protein in beer is not good. That's why, I don't know if you guys seen, we have something called spent grain, separate topic, but spent grain is very high on protein content, and you can use that spent grain to actually make upcycled protein, which we actually do with a product called Evergrain. That said, protein, we want to extract it out of the beer because that protein causes haze. So extracting the protein in the process when you're doing the boiling actually helps you get a clearer, that's why beer is clear. And when you have a haze, it's because there's proteins present. And when you have less protein, you're actually going to consume less energy because you need to boil it less and for less time. So you have an efficiency there that we can measure. And we were able to do this with the ROSI methodology. And I can go on for more examples, but these are two very clear examples that we were able to measure and get returns of millions of dollars, not just thousands.
Yeah, so just a couple comments from Kimberly-Clark's perspective. So we do have a goal to reduce our plastics, our fossil fuel plastic use by 50% by 2030. And the impacting the supply chain is critical, right? So we're using the ROSI tool to really help us understand how we can bridge the gap between what our plastics cost now, our fossil fuel-based plastics cost now, and what those alternatives will cost. And that's important because we're going to have to pay more, right, at the beginning to drive scale in the industry, right? Until you drive scale, you don't get the cost. So so we believe that ROSI is that path forward to do that.
Excellent. Got a lot of hands up. Thanks.
Virginia, this might be best for you, but Mike, you may have perspectives as well. It seems to me like another critical input for you is water. And given the general consensus that what we're paying for water is far less than what it's actually worth, be interested in your perspective on whether it's using ROSI or something else, how you establish or how you factor in a truer cost of water into whether it be your product decisions or your supply chain decisions.
That's actually a great question, and you are absolutely right. There are places in the world where water is actually free. We don't use that ROSI methodology for water. We have a very sophisticated model where we measure first our risk in terms of water around the world. We actually haven't monetized it, and I think it's an amazing opportunity. We're trying to do that as well. We did our TCFD model back in, I want to say 2019, I developed it, where we were looking at our physical risk, monetizing what that water risk would mean for the company. So basically what we did there is understanding and making some assumptions of if it's risk, what is the probability of that facility shutting down? And I kind of like invented an internal methodology that is not public because it was invented by me, so it's not very, very official. But kind of making sure, okay, what if the facility is shut down, assuming some months of shutting it down, you have to build another one elsewhere because there are some political issues also associated with it. And there was a very high risk. There was a very high risk with those assumptions. We are redoing our TCFD model. I think it actually came out, I'm not sure if it came out on this ESG report or the next ESG report, I need to check. But, and then we're refining those assumptions. But obviously the cost of shutting down a brewery that produces over 10 million hectoliters a year is extremely expensive. Not taking into consideration, obviously, the logistical costs that is also going to incur because you're now going to have to kind of change your entire supply chain to be able to deliver the beer that you were supposed to produce in that place and how long it takes to actually produce another facility now. So that's kind of like the approach that I took to measure that.
Thank you. Question about healthcare. It's estimated that there'll be like 1.2 billion refugees by 2050, depending on how you read. So are there any like innovative, sustainable ways of tackling that? Maybe sun-powered clinics or some kind of machinery, that kind of thing. I mean, it's usually very expensive for these countries to afford that, but I don't know whether there are any ways. And I hope you have brought some beer samples here. Maybe diapers.
It's interesting. 10 years ago, we were the only organization focused on climate impacts in healthcare. And it's been talk about change. It's been a fundamental sea change now that the Red Cross and Doctors Without Borders and so many other global health organizations are actually getting into understanding their own climate footprint, but also how can we deal with that influx of refugees? How can we deal with the fact that there's, in places like India and other places, there's such an unstable grid that installing renewable energy in clinics actually improves resiliency and performance at the same time. You can do surgeries at night. You can deliver babies at night. You have equipment that you can have solar refrigeration for the critical vaccines that we need. So there's an enormous opportunity to transform global healthcare to both achieve global universal healthcare access and also having it be climate smart. So the USAID now is solarizing 10,000 clinics in Africa. There's enormous momentum to sort of think about what is that sort of bottom of the pyramid technologies that can guarantee everybody on the planet healthcare access, because basically we're going to need to take care of everybody because everybody's going to be affected by this climate crisis. It's the greatest public health threat that we face. So there's a transformation and innovation and investment opportunity that's vast in healthcare.
I think we have time
Great.
for one more question.
Fantastic. Who's going to win the lottery here?
Hi. My question is on the price cost benefit analysis. Virginia, you brought out the cost of sustainable investment. So my question is for Michael on the commodity side, right? Like Huggies, there's not much price elasticity. So how do you absorb, or one method would be to pass it on to the customer, creating a diversified product. But what other strategies for cost optimization or managing the cost of sustainable investment?
So that's a great question, right? And I would love to say we could pass this on to the customer, but we all know that we cannot do that. So I think there is some price elasticity in the fact that if you do have a more sustainable, if your product is more sustainable on the shelf, right? Can you charge a little bit more? I think our younger generations definitely would say yes. I would say that Kimberly-Clark right now would say no, right? So there's really not room for that. And I think how we deal with that, and I sort of touched on it earlier, is we need to develop scale in the marketplace, right? I don't know how else to do it, right? Scale will drive down prices. And if you're talking about a substitute, right? If you're trying to get away from fossil fuel plastics, we have to drive that, and that's and through we're going to do that through partnerships with our suppliers, right? Strategic, right? So if they get, they're our first call, right? If they develop this, right? Obviously, it's advantageous for them to partner with us. So I think in general that's our path forward, specifically for Huggies.
Well, thank you to our whole panel. Much appreciated. Great comments. And I'm sure there'll be a lot of questions in the hallway after this.